Welcome to Chapter 16, your final chapter on treatment of psychological disorders. So we're going to start with a little history in the treatment of psychological disorders, and we're going to see some of that history is some cruel, brutal stuff. And then we're going to move into modern times and talk about different approaches to therapy and try to find the commonalities in them, even though we're going to be talking about different approaches. A lot of those perspectives that we have explored in other chapters, we will re-explore here because each perspective has its own approach to therapy. Some of those approaches are known as insight therapies, and that's going to include Freud and those who came after him and the humanistic perspectives. There are behavior therapies and cognitive therapies. And then toward the end of the chapter, we're going to talk about biomedical therapies, which is mostly the use of medications. And then we're going to look at what research and evidence we have that tells us what are the factors that make psychotherapy effective, and what are some modern day approaches, some that are extremely relevant in these days of COVID-19 quarantine, like e-therapy. So we're going to start with the history of treating psychological disorders. We discussed this in class 1. This process known as trephination that we have found in some of the most primitive cultures of human beings and the archaeological evidence that we have of those cultures. We have found skulls with purposely cut holes in them like this, known as the process known as trephination. And the theory is that even primitive human beings had this idea that if somebody in your tribe, in your culture, in your family was doing something that was abnormal, that was out of the ordinary, maybe disruptive, distressful, that they believed it was caused by evil spirits, and they thought those evil spirits were residing in the heads of the people. So if they cut a hole in their head, they would let the evil spirit out, was their belief. It's pretty impressive that even primitive human beings had some kind of understanding that, something in our head is important. They had no knowledge of brain or anything like that, but we saw this process go on in these primitive cultures. And the reason it went on is because it probably worked. If you had somebody in your tribe or family acting really bizarrely, which in modern day we might say diagnose with schizophrenia, and then you cut a hole in their head, they probably were not acting so bizarrely anymore. Not because you let an evil spirit out, but probably because you caused brain damage. So we saw the thinking about mental illness evolve, and the ancient Greeks, starting with folks like Hippocrates, started getting onto something, started thinking that there could be something biological, something physiological that would cause something psychological. And Hippocrates developed this rather complex theory of how psychological functioning and physiological functioning are dependent on what he called four humors, or four bodily fluids: blood, yellow bile, black bile, and phlegm. And he felt that humans will be functioning their best psychologically and physiologically if each of these bodily fluids was in the proper level, and developed this belief that if you were different, if there was something off with your behavior, your psychological functioning, then it was probably because one of these bodily fluids was out of balance, that you had too much or too little. Well, we now know he was totally wrong, but it was important to realize that even in ancient Greek culture, they were starting to think that there was something biological responsible for the psychological. We're going to see, sadly, this didn't change and evolve. People returned back to supernatural explanations for the psychological. And then even when people did return to looking at the biological and even looking at the four humors, they came up with quote unquote treatments that were not the kindest or the best. So if they had the belief that you're acting the way you are because you've got too much blood, let's let some of it out. Let's bleed you out a little bit. Well, again, it might have worked. It might have changed the person's behavior, not because you're curing the condition, but because now they're bleeding out. Now, last chapter we talked about stigma. And even in modern day, there's stigma associated with mental illness. Well, in the ancient world, it was even more significant because people had the belief that if you had, let's again use the example of what we would diagnose today with schizophrenia. If you had a family member in the ancient world who was showing signs of schizophrenia, they would believe that person is possessed by the devil. And that person or that family must have done something bad in order for that to happen. So if you had someone in your family with a mental illness like that, you certainly would not want the community to know about it, because then they would think badly about not just the person, but the whole family. So starting in the early 1400s, we saw the first asylums open up. These were not places of treatment. They were places where those who have what we would call today mental illness could be literally sometimes locked away out of sight where they couldn't bring shame to the family or the community. Sometimes these people were literally chained in rooms, chained to beds. And again, not a very positive, picture of mental illness. It was quite deplorable for these poor individuals. In fact, one of those asylums was famous, St. Mary's of Bethlehem, often abbreviated by the word Bedlam, which is in modern English language, is a word that means chaos, which is exactly what such an asylum would have been characterized with, a bunch of, mentally ill people, probably hallucinating, disorganized, and no one doing anything to help them. It became what I call like the beginnings of modern day reality TV. The rich would literally pay money to tour this asylum and see the mentally ill acting all bizarrely for the entertainment of the rich. Very sad, but people do the exact same thing today. Anytime you turn on a cable station and watch a show like Rich, Housewives or of wherever, or, let's get real contemporary, Tiger King, people are doing the same thing. They are getting their entertainment out of the disorganization and disorder of other people. Now, those were places where people were locked away. And even when, people wanted to do something to treat the disorder, those treatments were not based on any science whatsoever. They included things like bloodletting, doing things that they thought might sort of shock the person back into their senses, like dousing them in boiling water or ice cold water. There are a couple of key people to know about in the history of major changes in the treatment of people with mental illness. The first is Philippe Pinel, who started in France in the late 1700s with a revolutionary idea. It's sad that what he came up with was so revolutionary, but this really was a big change. His big idea was, hey, let's unchain these people and treat them nicely and kindly, like human beings. Let's give them pleasant surroundings. Let's do things to calm them. Let's give them activities to keep them busy and to, engage them in things like gardening or hobbies to keep them involved and calm. And let's just treat them with kindness and respect. Again, in the late 1700s, they did not know much at all about how to fix these problems, but treating people like human beings and treating them like kindness and not locking them up and chaining them up and making sure they are well cared for, that definitely helped, and that was a revolutionary idea in the late 1700s. Now, Dorothea Dix is the person who is most famous for bringing those ideas to the United States in the mid to late 1800s. She originally was a school teacher, but she ultimately helped establish the first hospitals for treating the mentally ill patients. It was a big movement, a big step. We're going to see still those treatments were not that great and not that effective, but she definitely was on to something, and she ultimately established the first 32 state hospitals for people with mental illness, where they're not just locked away, but they were getting some kind of treatment. Sadly, what started out as a good idea suffered the same kind of problems that we encounter in our modern day mental hospitals, that soon you didn't have enough funding to do what you needed to do, you had too many patients, not enough staff, and those hospitals deteriorated. Now, in those early hospitals, again, the treatments that they were doing did not have much effectiveness. So this is a photo that might have been taken in one of those early hospitals, where what you see going on here is probably men with maybe severe depression or schizophrenia sitting in ice cold baths. Again, a lot of the idea was, let's see if we can shock the system, shock them back to their senses, back to normal. Sort of think of an analogy like if you got a problem with your computer, what is the first thing, people, you call a customer helpline, tech support, what are they going to tell you to do? Well, let's see if you reboot, turn it off and turn it on again. So that sort of was the idea, let's reboot these people. Let's sort of shock them back to their senses. Other things that they did in these early hospitals, doing things like lobotomies. So lobe, again, sort of refers to the lobe of the brain. The root tome means to cut. So a lobotomy is essentially cutting the lobe. What they were mainly doing is cutting the frontal lobe. The way they did it in those early days is they would go in with a very thin scalpel right above your eye through the orbital socket and shove it up into your frontal lobe. And again, you're doing this without the benefit of modern day things like CAT scans or anything like that. And you're just sort of swishing around and cutting the connections in the frontal lobe. Did it work? Probably. So if you had a very, very disorganized, combative, out of control person with schizophrenia and you give them a lobotomy, they're probably more under control, not because you did anything effective, but because they have brain damage now. So they're probably more docile and easy to handle. Other things that they would do is purposely induce comas through overdoses of insulin. So, here would be a person in that insulin coma, with the idea that maybe when he wakes up, he's going to be back to his senses. He'll be back to normal. Well, issue is sometimes these people didn't wake up. Another early treatment, one that actually showed some promise and actually has some benefits, is electroshock therapies. We're going to see how they do it in modern day is far better than how they did it before. But what you're doing in electroshock therapy is you are purposely inducing a significant seizure in the brain of the person by administering purposeful electrical jolts through their head. So you can see here that the people are shocked into a grand mal seizure. In the early days, people would often hurt themselves by throwing themselves off the gurneys and things like that. So here now you see a bunch of people thinking they're doing a brilliant thing by let's forcibly hold this person down while they are convulsing. And doing that, sometimes people would end up with broken bones, bitten off tongues, things like that. But we're going to see this is one approach that actually does work, and how we do it in modern day is far better. All right, so now we're going to get into the more how we get into the modern day approaches. We're going to see there's different approaches, but they do have a common goal in mind. So there are two very broad categories of treatment of psychological disorders. The first is psychotherapy. That's sort of a general term for what we would associate with some kind of talk therapy. A person is going in to see a therapist, and that therapist, depending on their perspective in psychology, is going to use some kind of technique to either help the person understand or change the behaviors and emotions that are distressing them. The biomedical therapies, for the most part, those involve prescribing some kind of medication to treat the symptoms of the psychological disorder. So why is therapy important? Well, we know that from the definition that you learned in chapter 13, in order for someone to have a psychological disorder, that means they're in distress. That means there's some kind of dysfunction, that their functioning at work, at school, and their social life is compromised. So that means if we don't do something, people are hurting, people are living with distress. They're not able to be meaningfully contributing to society, contributing to their own, academic or vocational progress. So there's lots of costs. It could affect the economy. You've got people who are not able to work and hold down a job and therefore have to depend on disability. So there are a lot of reasons why it is important to treat these mental disorders. Reasons that are important to the individual as well as to society in general. So if it's so important and we have these options, why is it that people are not getting the therapy that they need? Well, there's a variety of reasons. Some of them are practical. Some things we take for granted living where we do, that we have such easy access to services in a metropolitan area. But if you are living like in a rural area, you simply might not have that access. So there are some you know, uh, very practical obstacles to getting treatment. We have to be honest, it takes money. There could be financial obstacles. People might not have good insurance, things like that. Um, Clearly, there's also that stigma that still exists. So even if you have access, people might not seek out the treatment they need because doing so would mean they have to admit they have a problem, that there's something they can't handle themselves. Um, Sometimes there's cultural things, resistance from the family, still that idea that mental illness is bringing shame to the family, especially with some cultures. I remember having a practicing Muslim young lady who had to essentially seek treatment, in secret because she knew that her family would not approve, that her father thought that if others knew that they had a child with mental illness, that she would never get a husband and things like that. So this poor young lady literally had to, as a college student, seek treatment in secret. All right, so there are different types of mental health professionals who um, are involved in psychotherapy. Um, if you use the PowerPoint and you click each of these, you will find the differences between the four main types of professionals and the education that they need. So psychologists, to be a psychologist, you need a doctorate degree, either a PhD or a PsyD. Psychologists, what sets them apart from the other mental health professionals, they're trained in diagnosis, they're trained in treatment, but they are the only mental health professionals that can do the psychological testing. So we learned about intelligence testing in Chapter 7. We learned about personality testing in Chapter 11. We learned about some instruments for measuring stress in Chapter 12. A psychologist is the only professional who can purchase, use, and interpret those kind of tests. The next type of mental health professional is a psychiatrist. A psychiatrist is a medical doctor, so either an MD or a DO. So they have gone through medical school and they have just specialized in the treatment of psychological disorders. Psychiatrists are often trained in therapy, but the vast majority of them do not engage in it. The vast majority of psychiatrists are simply prescribing medications. Then there is the profession of social work. To be a licensed social worker, you need a minimum of a master's degree. There's quite a bit of overlap between the training of psychologists and social workers. Social workers cannot do any of the testing though. Social workers are also a little more trained in helping people gain access to services in the community, to deal with other related problems like accessing services for poverty, planning aftercare. Anytime a person's in a hospital, a social worker is involved in the discharge planning, making sure that patient has whatever services they need for after they're discharged. And then the final one is a counselor. To be a licensed professional counselor, you need a master's degree. The counselor's training I really like their training. They have a little more practical approach, dealing with day-to-day problems. They have a very nice approach to therapy. Sadly, what I have seen is that many counselors are underutilized. Usually they're involved in things like, you know, working in schools where they're helping students pick their classes, plan for college, etc. And that's really just a small portion of what they are trained to do. All right, so now we're going to get into the different types of therapies, and many of them are based on the different perspectives of psychology that you have been learning about since chapter 1. So the person's perspective is definitely going to influence how they would go about treating psychological disorders. So the first few types of therapies we're going to talk about are, again, just those that involve the traditional talk therapy where a client is going in to see and interact with a therapist. Later in the chapter, we'll get into the biomedical therapies. We're going to discuss the therapies from the different perspectives, just so you can learn them and understand their origins. But in the real world, if you ask practicing psychotherapists what perspective they are, they would most likely say that they are eclectic. That means that they are aware of the various perspectives and the various approaches, but they don't limit themselves to just one, that they will draw upon the different perspectives and do what they think would be best for their unique client with their unique issues. We're going to see the psychotherapies are broken down into two broad categories. So the first category are known as insight therapies. You have a link to a video here. That video is also linked separately on the Canvas page. I strongly encourage you watch that and take notes on that. So what these therapies have in common is that their goals are to raise your insight. The idea is that if you have better awareness, better understanding of your problems, then that is the key to fixing them. The other category of psychotherapies that we're going to learn about in the next part that I'm going to record are the behavior therapies. These are ones that focus on changing behavior, including changing thinking. Thinking is a behavior as well, without focusing on insight. So the behavior therapies say it's not necessary for you to understand how your problems developed in order for you to change how you respond to them. Whereas the insight therapies say that understanding is a key part to your therapeutic success. All right, so we're going to start with one of the oldest, the psychoanalytic perspective from Sigmund Freud, and then the psychodynamic therapies that followed after his. So you've learned about Freud going all the way back to chapter 1 in his psychoanalytic perspective. So remember, the main thing about him is his belief that everything is coming from your unconscious, that things that are outside of your awareness are influencing your current behaviors and emotions. So therefore, if you bring that unconscious to your conscious awareness, you are able to solve your problems. So again, he would focus on trying to figure out what's going on in your unconscious mind, raising your insight, and therefore letting go of your anxiety and your fears and your other symptoms. So we've touched upon this in past chapters, how Freud would approach therapy would be very, very different from how a person would typically go into therapy in modern day. So the main thing is the person is lying on a couch. Freud would be sitting here behind them. They would not be making eye contact or seeing each other. They would not be having a direct conversation about your problems because from Freud's perspective, he would say by definition, you can't be aware of your problems because they're stemming from your unconscious. So he would engage in a lot of things to indirectly try to access what's going on in your unconscious mind. One of them we talked about going way back into chapter 4 when we talked about sleep and dreaming. In therapy, he would talk about your dreams and he would do a lot of interpretation of what he felt those dreams meant in terms of your unconscious conflicts. He would do other things to try to access your unconscious. He would engage in free association. He would say a word and say, tell me the first thing that comes to your mind when I say this. And he would just keep that up and it'd be sort of, not a direct path. And things that you would say, he would interpret as having meaning. And even things that you didn't say, he would interpret and think that that had some meaning in terms of your unconscious. So let's say, for example, during free association, he says the word father, and then suddenly the person hesitates and doesn't give a response. That is what Freud would call resistance, and he would interpret that resistance means something. Why did you hesitate when, I said father? That must mean that your problems stem from some early interaction that you had with your father in childhood, for example. He would also be interested in transference. He would feel that how the person interacted with him, Freud, in therapy would be representative of the person's true feelings to other authority figures, namely the parent. So if someone got mad at Freud in therapy, he would not see that as you're really mad at him. He would say you're mad at your therapist or your parent, but you're taking it out on your therapist. So let's interpret what that means. So the modern day approaches that are based on Freud's early ideas are what we call psychodynamic therapies. They are quite different in that there's a lot less, things like free association and stuff like that. The person is facing the therapist and they're having more of a direct discussion, but there still is some degree of interpretation, some belief that figuring out what went on before these problems started are the key to figuring out why you have the problems. But it's a shorter term, more direct, more collaborative approach to doing it. All right, the next category of therapies in the insight-oriented therapies are the humanistic therapies. So again, you've learned about the humanistic perspective going all the way back to chapter 1. Some main differences with the humanistic approach to therapies is that they're present focused. Their belief is we can't change the past, things that are already done, so it doesn't really matter that we focus on those things. They're focusing on what you are aware of versus what you're not aware of. And the focus of the humanistic therapy is being aware of what's going on in the here and now and taking responsibility for it and trying to follow that humanistic pathway that we've learned about before of becoming your best self, proceeding toward that self-actualization. So person-centered therapy is the approach of a famous humanist that you've learned about before, Carl Rogers. So we talked about this in previous chapters. We talked about this in the personality chapter in the humanistic theory of how your personality develops. The same kind of things were focused on in person-centered therapy with Carl Rogers. You know, he would be of the belief that everybody has the potential to be their absolute best selves, and that we get there, we develop our best selves if we are exposed to those three qualities that he emphasized. Genuineness, so we are surrounded by people who are being their true selves. Acceptance, or that unconditional positive regard, where you're not being judged, that no matter what you have done, they're still going to believe you at your core are a genuinely good person. And then the third quality, empathy, that you have people around you who are continuously showing you, we get where you're coming from, we understand you, we understand what you're feeling. So Rogers would be of the belief that these are the same three things that you need from a therapist in humanistic therapy. And he would provide these things through a lot of active listening. So in Rogers' approach to therapy, it's totally non-directive. He would never ever be telling you what to do or giving you advice, because he would be of the belief that you're a perfect person waiting to happen. You already know what you need to do to solve your own unique problems. His role would be to help you just get to the point where you can figure that out for yourself. And he would do that through active listening, reflecting back what he hears you saying, clarifying what you're saying, and in doing so, he's showing you, I'm tuning into you, I'm paying attention, I think you are worthwhile for me to pay attention to, I am accepting you, I'm not critiquing you, judging you, I am showing you that I'm trying to feel where you're coming from. And in doing that active listening, he would be showing those three traits of genuineness, acceptance, and unconditional positive regard. So you have this nice summary table from your textbook describing the characteristics of a therapeutic relationship in Rogers' approach to therapy, with those characteristics of empathy, unconditional positive regard, and genuineness, and conveying all of that through your active listening.